Now we do have a chance to return to San Francisco. I believe I'm right on this. The Kinship Support Network from San Francisco County, Bill Betancourt and Lillian Johnson.
Good morning and thank you. In the 1980s, with the advent of the crack epidemic, the foster care caseload in San Francisco increased dramatically. During those years, I was an emergency response worker and had the personal experience of, on a regular basis, asking relatives to consider caring for children whose parents no longer could do so. Usually these relatives were grandparents. Often the children were infants born exposed to drugs, usually crack. And at this time, we didn't have a lot of knowledge about what the long-term impact of that exposure would be for the children and for the caregivers. And as a worker, I didn't have a lot of resources to offer these relatives as they considered this choice. Often they made the choice simply because the alternative of the kin going into the foster care system was simply unacceptable. Our early experience in San Francisco showed that some 20 to 25% of these kinship placements failed in the first year of placement. In response to the need to find support for these kin caregivers, in 1992, we provided funding to the Edgewood Center for Children and Families to develop a kinship support program. We believe that the key to the success of the development of the program was that the planning, program design, and implementation should be done with the ongoing involvement of the caregivers themselves, so that it would be a program that met their needs as they saw them and not as we so-called experts thought it should be. Today, fewer than 5% of these kinship placements experience failure. The issues that relative caregivers face in the areas of health, finances, social contacts, and psychological well-being are being met by the Kinship Support Network. We have learned from this experience that our systems, through public-private partnership, with a commitment to a consumer-driven planning, implementation, and self-evaluation process, can make a difference.
In 1992, when the Department of Human Services came to Edgewood and asked us to be a partner with them to look at the kinship care families that were failing and returning the children to care, we jumped at that opportunity. They allowed us 1 year to do planning. At that time, I went around and met with small groups of relative caregivers that were meeting in their kitchen, around their kitchen tables and in church halls to find the only means of support that they really had available to them at that time. After the year, the three things that they really came up with, what they needed was they wanted recreation because they didn't have any fun in their lives anymore. Most of them had given up their retirement years or had to set 3 and 4 different new places at their dinner table. They needed respite because they needed to get away from the children, and the children needed to get away from them. But most of all, what they needed was respect, that they felt disrespected, and that they felt that people were living under the old myth of the apple doesn't fall far from the tree. When we began to set up the program, what we did was we hired kin caregivers to provide direct services to kin caregivers because we knew that they would understand the issues and they would provide the respect that they required. The state became so interested in our program that they asked us to meet with them and to work with them in developing legislation that would provide statewide services to kin families, which were, the caseloads of kin families were increasing the child welfare loads, workloads dramatically. We jumped at this opportunity as well, and in 1997, 3 sets of legislations were developed. One, to provide a series of service centers around the state of California, using Edgewood as the model to provide kinship support network services. The second one was a financial a legislation that provided kin gap payments to provide legal guardianship to caregivers so they could leave the public system with a subsidy. And third, a kin adoption law that allowed for the strengthening of adoption as an option for kin caregivers in the state of California. In addition, for Edgewood, the legislation provided that we could then become the technical assistance agency for the state of California to go around and train and promote and advocate for the issue of kinship care. During this process, the Department of Social Services requested that we develop an outcome and evaluation component in the program, and that we collect data on kinship care, which we have done from the very day we opened our doors in '93. We just recently completed a 5-year longitudinal study in this research component showing that based on the input from the families we've served, that both their mental and physical health have greatly improved since they received services from us, while a similar control group in the Department of Social Services has their health, both mental and physical health, has decreased during the period of time of caregiving. In addition, we now are working with people from all over the country. I just recently returned from Tennessee, where I've been doing consultation with them for their new state legislation on kinship care. I am also a part of the group of people that are working toward a national platform on kinship care, that we feel that these services using grandparents as the key in the heart of the program, that promoting more people out of the system or getting them out of the system with supportive services will greatly reduce a very cumbersome and expensive child welfare system. Thank you.
Thank you. Carl Weisbrod.
The results of reduced numbers of failed placements is very impressive. Are very impressive. I had a hard time figuring out exactly what services are now being provided to kinship placements that were not being provided in 1993. I understand the other aspects of the state legislation, but specifically with respect to what services are being provided to the kinship placements, I'd appreciate it if you could.
Yeah. If you could elaborate on that, I wondered if it were possible if you had a family in mind or somebody you could point to that you could tell us, here's what it was like before in this Jones family, here's what it's like now. That's what I think I was struggling with too.
Okay. Well, let me just go first into the question about the kinds of services and about the families just in general. We believe seriously that these are very unique families, that these families have been hidden in the system. After we dealt with these families for a number of years, we found that they were closeted in public housing, in different communities, because they were always fearful of losing their children back to the system. Most of the children that we work with, or the families we work with, are families that are not in the system, but they're poised to go into the system. So they hid. They really didn't participate in any kind of services. For example, I have a family, one of the grandparents that worked for us, for example, Thelma. She had a daughter that was mentally ill and also involved in drugs. This is a woman who was not poor. She was very middle class, African-American woman, who had 2 granddaughters who were 9 and 13, who were living in abject poverty in Richmond, California. She got to the point where she could not stand it anymore.
Who were they living with?
They were living with their mother. She went over there literally and kidnapped her granddaughters and took them back. And she has raised those 2 granddaughters. One now is in graduate school, finishing up her teaching credential, and the other one is just going to be a senior at Cal Poly. These are wonderful young women who I wish I really could have brought them here today to talk about what we did for that grandmother.
What did you do?
Well, what we did was we provide support groups that are unique, that are totally unique for grandparents, that are peer facilitated. We provide programs that are targeted just for relative caregivers. One of the things that relative caregivers have said to us across the country as I travel is that they are different. They are little old ladies raising babies, and no one likes to see that. They don't want to talk to young people. They want to talk to people that are doing what they're doing. Their children say the same thing. They're embarrassed about being raised by older people oftentimes, and that they really would like very much to be around kids that have the same issues as they do. We provide an independent living program for adolescents that live with older grandparents. We have a mental health component that deal with the issues about family rejection and abandonment. That we have a mental health component that deals with the caregivers that relate to their guilt around what's happened to their children, their depression about losing their children, their depression about losing their retirement years. That we do the basics that a lot of agencies do. We provide tutorial services and homework assistance and lots of recreation activities for the children, just in general. But the groups are unique kin kids, and kin kids see themselves as being somewhat different.
Susan Schwab.
I want to go back to Thelma because if the daughters were 4 and 9, and they're
No,
now
9 and 13. at
9
that
and,
time.
9 and 13, what impact did this particular program have on Thelma's granddaughters? Because you started in 1993, and one of them is coming out of graduate school now. The timing doesn't quite work.
Right. Well, yeah, she
The
is
oldest
coming
should
out.
be 20 at this point.
No, she's 13. That was 7 years ago.
Okay,
So
the
she,
oldest-
she is out of graduate school. She is, real, honest to goodness, she is. Samil is out of graduate school. So what? Maybe she was older than that. Maybe she was 15. I'm not sure. But I know that Davin was 9. What we did for those kids is that Davin entered, when she became 12, she entered our independent living program at age 12. And what we did is that Davin was failing in school. Davin is a very, very bright young woman. And that what she did is gave her direction, as she said, that it gave her hope, that she wasn't embarrassed about being a kin kid anymore, that she finally learned that her grandmother was sacrificing for her, that she showed a different level of respect for her grandmother. As Thelma said, there were times that she could have killed Davin, that she was so disrespectful to her. But as she got together with other kids like her, they all started to realize the fact that these relative caregivers do the best job they can, and they love them, and they've sacrificed for them. And that by the time that Davin has come out of school, out of college, she's still in college, she's at Cal Poly, she is really, she's got her head screwed on straight, she's respectful, and she cares about what's happening to her grandmother. Thelma's still just retired from the program this week with me. I'm retired from the program myself. And that she has spent the last 7 years working with grandparents like herself to make their lives better.
Can I just ask a question about replication? Your application talks about 12 other California counties that were looking at this and contemplating launching this kind of program or similar. Where does that stand now in terms of?
Oh, they're all active. We have 11 counties. The 12th county did not enter. Fresno County did not come in. That all the counties, including Los Angeles, San Diego, San Bernardino, Alameda County, Monterey, Riverside, San Francisco, San Mateo, Contra Costa.
And they have programs up and running.
Up and running. The 3 that aren't up and running yet are San Bernardino, Alameda, and Stanislaus. I didn't mention Stanislaus. They're starting this year. The other 8 counties have up and running programs. In San Diego, there are now 8 centers that have been replicated, similar to the one that Edgewood started.
Our time's up, but Lee and Pat, if you want to ask, do you want to pursue? Pat, please. Please.
Do you have any challenges, legal challenges to your decisions on guardianship when you place these youngsters with their grandmothers?
No, I think that most of us really do believe that children belong within their family network, and we make every effort to support them in that process. There are families that are going to fail, and we understand that, but, birth families fail, adoptive families fail, foster families fail. And I think that this county government has said that we really have a vested interest in making kin families work, and if we support them and we help them obtain permanency through guardianship and adoption, these children are going to be better off, and we think we've been successful in doing that.